Cardiac surgery is a life-saving procedure for heart diseases, but it can lead to complications like post-cardiotomy syndrome, PCIS. PCIS is a condition characterized by inflammation, pericarditis, and pleuritis after surgery. This video will explore its causes, effects, treatment, and impact on patients. The pathogenesis of PCIS involves a complex interplay of multiple factors, including the activation of inflammatory cascades, release of pro-inflammatory cytokines, complement system activation, and immune dysregulation. These processes are triggered by cardiac tissue trauma, ischemia-reperfusion injury, and surgery-related factors such as foreign antigen exposure and alterations in the coagulation system. A comprehensive understanding of these mechanisms is crucial in order to develop targeted therapeutic strategies and interventions aimed at preventing or mitigating PCIS. The immunological response in PCIS is characterized by increased activation of innate and adaptive immune cells, including neutrophils, macrophages, and T cells. These immune cells play a crucial role in the initiation, perpetuation, and resolution of the inflammatory processes observed in PCIS. Various immune-modulating factors, such as toll-like receptors and pro-inflammatory cytokines, contribute to the immunological response. Deciphering the key players in the immune response is essential for developing targeted immunomodulatory therapies to attenuate PCIS-related inflammation. Post-cardiotomy syndrome, PCIS, involves a cytokine storm, where excessive release of pro-inflammatory molecules leads to tissue damage and systemic effects. Dysregulated immune cell activation and crosstalk between cellular components play a pivotal role. Understanding these mechanisms is crucial for developing effective interventions. Research has shown that genetic factors may contribute to the susceptibility and severity of PCIS. Genetic variations in immune response genes, inflammation-related genes, and coagulation pathway genes have been implicated in the development of PCIS. Identifying specific genetic markers associated with PCIS can help stratify patients at risk and guide future therapeutic interventions. Genomic studies and advancements in next-generation sequencing techniques offer promising avenues for further investigation into the genetic predisposition to PCIS. Emerging evidence suggests that autoimmunity plays a significant role in the pathophysiology of PCIS. Molecular mimicry, wherein self-antigens resemble microbial antigens, can trigger an immune response leading to autoimmunity. The identification and characterization of autoantibodies and autoantigens associated with PCIS provide insights into the underlying mechanisms and potential therapeutic targets. Elucidating the role of autoimmunity in PCIS can pave the way for targeted immunotherapies and immunomodulatory strategies. Advancements in surgical techniques, including the adoption of minimally invasive approaches, have significantly impacted the incidence and severity of PCIS. Minimally invasive cardiac surgery reduces surgical trauma, foreign antigen exposure, and systemic inflammatory response compared to conventional open heart surgery. Understanding the impact of surgical techniques on PCIS can guide clinical decision-making and contribute to the optimization of surgical interventions for improved patient outcomes. Infectious triggers, such as viral, bacterial, and fungal pathogens, have been implicated in the development and exacerbation of PCIS. These pathogens can activate the innate and adaptive immune responses, leading to the release of pro-inflammatory cytokines and immune-mediated tissue damage. A comprehensive understanding of the infectious triggers of PCIS is crucial for early diagnosis, appropriate antimicrobial therapy, and the prevention of complications. The identification and validation of novel biomarkers for the early diagnosis and prognostication of PCIS have become an area of intense research. Biomarkers such as C-reactive protein, interleukins, and cardiac troponins have shown promising potential in predicting the development and severity of PCIS. The integration of these biomarkers into clinical practice can enhance risk stratification, guide therapeutic decisions, and monitor treatment response in patients with PCIS. Secondary constrictive pericarditis, a rare complication of PCIS, occurs due to chronic inflammation and fibrosis of the pericardium. An accurate diagnosis, aided by diagnostic imaging modalities such as echocardiography and cardiac magnetic resonance imaging, is crucial for appropriate management. Surgical pericardiectomy remains the treatment of choice in these cases. A comprehensive understanding of the clinical features, diagnostic approach, and management strategies is indispensable for optimizing patient outcomes in secondary constrictive pericarditis. Despite optimal medical management, some cases of PCIS may prove treatment-resistant, highlighting the need for alternative therapeutic strategies. Immunomodulatory therapies, corticosteroids, and targeted biologic agents have shown promising results in refractory cases. Additionally, adjunctive measures such as percutaneous drainage of pericardial effusion and supportive care play a vital role in improving patient outcomes. Exploring alternative therapies and establishing treatment algorithms for managing treatment-resistant PCIS is of utmost importance. Identifying perioperative risk factors and predictors of PIECES is critical for risk stratification, perioperative planning, and implementing preventive measures. Factors such as preoperative comorbidities, surgical technique, duration of cardiopulmonary bypass, and perioperative infection contribute to the development of PIECES. Risk prediction models incorporating these variables aid in predicting individual patient risk and allow for personalized preventive strategies. Cardiopulmonary bypass, an integral component of cardiac surgery, significantly impacts the occurrence and severity of PIECES. The systemic inflammatory response triggered by cardiopulmonary bypass plays a pivotal role in the pathogenesis of PIECES. Implementing strategies to minimize the adverse effects of cardiopulmonary bypass, such as modified perfusion circuits, pharmacological agents, and temperature modulation, has shown promise in reducing PIECES incidence and severity. Understanding the mechanistic considerations and implementing mitigation strategies can further optimize patient outcomes in cardiac surgery. In conclusion, post-cardiotomy syndrome is a complex condition involving various immune responses and underlying factors. Understanding its pathogenesis, genetic, and infectious triggers along with immunological responses, surgical techniques, autoimmune mechanisms, biomarkers, treatment, risk factors, and cardiopulmonary bypass helps improve patient care and develop interventions.